Hello everyone, good evening. Welcome to webinars conducted by Emergency Department Yashoda Hospitals. So today we have a topic of clinical feedbacks, which is regularly not discussed much. This is a different topic, which is most important thing, which we never consider actually. So today we have an international faculty with us to give a talk on this. She is Dr. Elizabeth L. DeVos. To be in precise about her, there'll be a lot to tell actually. I just want to be in precise. So she is a professor in emergency department at University of Florida, Jacksonville, and she is a director of global health education, which were conducting the programs at UF College of Medicine, as well as she is executive board member and director of International Federation of Emergency Medicine and American College of Emergency Medicine Federation. So now I request Dr. DeVos to go ahead further.
Hi, good evening. Good morning to those of you who might be joining in from the United States. I don't think there's many, but good evening to all of you in India. And thank you so much for having me and inviting me today. I'm very happy to be here and happy to have the invitation. I was a little bit surprised that we're using a webinar, so I apologize. I'm going to try to keep the questions and answers available in the chat, but Dr. Vinith, maybe you can help me with that as well. I'm going to share my screen, and the very first thing I'm going to do is I'm going to put up a QR code. And if you are with your devices, in this case, I actually would like you to use your devices, and please go ahead and scan it. You'll find a Google Doc there that has some references for this talk, but also some cases that we'll use for practice throughout the session, and so you can refer to them there. So thank you very much for having me today, and we'll get started. I was hoping to hear a little bit from you about the types of people that you work with in your departments, but I think we'll just start with a picture of mine. So this is my hospital. This is the University of Florida College of Medicine in Jacksonville, Florida. We're in Northeast Florida near the Atlantic Ocean, and we are a very well-established teaching institution, one of the first emergency medicine residencies in the United States. And here we have 15 or 16 emergency medicine residents in each batch, and they complete a 3-year emergency medicine residency. We also have pediatric emergency medicine fellows in our department, as well as students in the medical school, physical assistance school, and nursing students. So there's always people in our department, junior faculty, residents, fellows, students who need feedback. And we expect that this feedback is given not only by the faculty, but also as part of graduated responsibility for our residents and fellows. So what is feedback? In the chat, can you tell us what you think of when you think of feedback? Maybe we can see a few answers.
Guys, you can just type the feedbacks. What do you feel about it?
Sometimes I hear people tell me, oh, it is my grade, or informally at the end of a duty rotation, I might hear from the faculty I was working with, oh, you did a great job today. Sometimes we get feedback to tell us, oh, well, actually the way you're doing that procedure is not correct. Let's redirect so that we can do it more properly, or you weren't successful, let's try again, and here's some ways you could do better next time. One definition of feedback is that it's the process of giving learners information about their current performance so that they may improve it in the future. And I think that the definition that Tala has put in the chat is a nice way to rephrase what we've just said here. Thank you, Tala. What is the purpose of feedback? We want to make sure that trainees understand the kind of progress that they're making towards our goals. We want to identify areas where we might need improvement. And also we want to motivate our students make sure that they are getting positive reinforcement of the work that they're doing so that they can continue to engage in learning activities. We're going to talk about 4 kinds of feedback briefly to define them here, and then we'll focus on informal and formal feedback. So informal feedback is your most frequent form of feedback. This is the things that we get day to day, anytime when we're on a shift. It may be a doctor, it may be some other person on the team, a nurse, a trainee, and it's usually in verbal form, telling us something about how we're doing. Formal feedback is often part of a structured assessment. These are things that might help us to define how the shift went. In my department, we use formal feedback in the way of a shift evaluation form. At the end of the shift, I write down something about how the resident did. There are several questions and it's structured. Usually this comes from peers or superiors. Formative feedback is a chance for trainees to learn how they're doing throughout a course or while they're acquiring a skill. This is kind of the checkpoint along the way to understand if you are doing well, to reflect on your efforts and make adjustments if needed before there is a grade or a formal assessment. And then summative feedback is that final examination or the final judging of your performance. Sometimes it's used to rank people, and final feedback. Explaining the type of grade you got and why you got it. So like I said, we're going to focus on informal and formal feedback today. We were going to play a game, and perhaps Dr. Vinith, can you think of a number for me? Don't tell me the number. Just think of a number.
Okay, sure. Yeah.
Okay. I'm going to give you some feedback.
Yeah.
So can you tell me, give me your first guess. I'm thinking of a number also. Give me your first guess of the number I'm thinking of.
You are thinking of?
Yeah, so tell me the number you're thinking of already.
9.
Well, yeah, that's a really good number, but it's not my number. Can you think of another number?
1.
1 is a great number. It really is the first number that some people think of. How about another one?
Then 7. Sorry, 6.
Okay. See, there you go. You've got lots of numbers that you can think of. What do we think about that feedback? Is that feedback kind? Maybe, but it's not really helping us get to the right answer.
True.
I was thinking of the number 17, but I'm not giving Dr. Vinith anything that's going to help him to get to the right answer, even though I'm being kind about it. Other times we might hear people say things that are not constructive and are also mean, and that also is going to be a problem. What we really need is someone to be able to give instructions on how to improve as well. So when we do give feedback, we need to think about those things. Sometimes feedback can also be difficult because it's not frequent enough, not specific. Sometimes we're afraid to be honest because we might hurt someone's feelings, or we may not give that feedback in a timely manner. If it's 3 or 4 days later, maybe you don't remember how it went on the shift that you were working with. Sometimes it's not delivered in a meaningful way. My residents sometimes tell me, oh, but every supervisor I work with tells me I did a great job today and it was fun to work with me. That's good, but it's not helping us to get to any of the things that need to be changed to be a successful physician. And sometimes we're giving feedback based on things that we didn't see ourselves, and that's also a problem. So what makes good feedback? We want to be setting goals and having good communication amongst the evaluator and the trainee. We want to be able to have assessment and feedback as well. So when we begin the learning process, we want to be sure that we're having shared goals that everyone knows. So we want to know about the goals of the learner. If you're on a specific rotation or class, we want to know the goals of that teaching opportunity. And we want to know the goals of the facilitator or the instructor. Then we can build an assessment that uses feedback and communication to continually adjust our goals to meet the needs of everyone on the team. When you are a trainee who is giving feedback to trainees junior to you, it's also important to know what are the goals for their educational elective or course. And it's important to get those goals. In my case, we tell our residents that they should look over the goals of the medical student rotation, and those can be obtained from the clerkship director or the program director. In your case, you'll need to think about who is the supervisor of the trainees you're working with. So when we talk about characteristics of effective feedback, we want to think about language, structure, and culture. And this could be different if you're working with people who are not from your own culture, but also we need to think about the culture of the institution where we are all working. So when we talk about language, we want to be sure that the feedback we're giving is specific. It gives someone an idea of what they actually can work on, and it should be based on direct observation. We want to be sure that the tone we use in speaking is not judgmental. And we want to be sure that we're looking at reflecting upon a changeable behavior. So it's not helpful to tell someone, I don't like the way your voice sounds. But you might be able to say, when you enter a room early in the morning, your patients might prefer it if you speak in a softer tone. When we also offer feedback, we can use a structured manner so that everyone can understand what might come next and also have organized feedback. There's several ways we can do this. One is to use W questions, and you can think about the W's when you ask your student or your trainee about their effort. How do you think that went? What do you think went particularly well with that patient encounter? What didn't go so well for you while you were putting in that central line? What could you have done differently in that conversation with your faculty? We'll talk about some other ways that we could do this. One is the feedback sandwich. That's the idea of giving a positive and then a negative and then a positive at the end. You also could ask your trainees and questions. So when the trainee tells you how they think something went, you could say, I agree. That was a very effective use of your collateral information to get history about that patient's background before they came to the hospital. And I noticed that you didn't have the opportunity to speak to the nurse that is here to get more information. Perhaps next time you might also want to speak to the nurse or something like that. So you can give something positive or feedback about what the student or trainee has just told you, then use and to link another piece of feedback to it. And is more effective than using but. So think about that in our language as well. We want to encourage two-way communication and for the feedback from the learner to also come to the teacher. And we want to include learner reactions and action plans for improvement. When we speak about an action plan, perhaps we can think of one or two ideas that the trainee can try with their next encounter or the next time that they do the same procedure. It's really important for feedback to be a part of the culture of the rotation or the department for us to be able to take it well. When people feel like they are being singled out or their efforts are being looked at very closely, then it may feel punitive. It may feel like a faculty member is picking on them. Similarly, if all of the faculty are not giving realistic and honest feedback, then it may feel like only one or two faculty have it out for many of the students. And this can lead to faculty not giving feedback as well. So it's important that there's an expectation for feedback amongst the department at the leadership level and at the orientation for every rotation. There should be frequent feedback every shift, but not only waiting for the end of the shift, throughout the day when things are noticed, or if you have the opportunity after a procedure, after a resuscitation, or even just an individual patient encounter, that's a good time for feedback. One thing that happens though is that many people say they don't receive enough feedback, and sometimes people don't recognize feedback for what it is. So it is a good idea to explicitly state that you are going to give someone feedback. I often talk to my residents and say, let's take a minute to have some feedback. How do you think that intubation went? What do you think could have gone better? And let the residents tell me about their experience. I then reinforce the things that they did well and try to give one or two teaching points at that time. We want to encourage our learners to give feedback and to ask for feedback as well. I tell my students and my trainees to ask me for feedback if they don't feel that I'm giving it to them. And at the end of the shift, also to ask for feedback. And like we said before, we want to limit this to one or two things. If we give too much feedback, none of them can be put into action. So effective feedback will reinforce good practice, promote self-reflection, and motivate our learners. We want to be sure it's given in a supportive environment. The old idea of praise in public and reprimand in private applies to feedback as well. We want to try to be sure that we're promoting active learning amongst the whole team. We want to make sure the students feel like they have the opportunity to make changes, and we want to be sure our students are engaged and proactive. If we are giving negative feedback regularly in public, that can make the staff and the team distrust the trainee who's given negative feedback. And it surely is detrimental to the morale of our trainee who's getting that feedback. And in reality, all of us should be getting some positive and some negative feedback regularly. So it's great to give kudos to the team or to individuals in front of the team, but try to think of a private and quiet place where you can give feedback and have a real discussion with your team when you're giving negative feedback, especially. We also need to talk a little bit about feedback amongst peers. In my department, several residents are working together all the time. And so we're giving feedback to each other as well. This can be supportive of increasing levels of responsibility. The first and second and third batches are all working together in our department. This leads to metacognitive gains, but sometimes we have concerns for honesty. Either people want to see their peers get a good grade, or they're afraid of retribution if they offer negative feedback. So it's definitely important to think about structured methods that can assist everyone to give feedback that is useful. So how do you give feedback? What are some specific ways that we can do it? Turns out that there are several methods described in the literature, and in the QR codes that I gave you were several articles that list many ways to give feedback. One is the Pendleton model, and the Pendleton model relies on 4 questions. Ask the learner what went well, then tell the learner what went well. So this takes the perspective of the trainee and the perspective of the faculty into account. Next, ask the learner what could be improved. Then the faculty gives information about what could be improved next. This is a really simple way, and I like to use this when I debrief after a procedure with my students. And I think it would work very well for all of you in your clinical work in a daily basis when you're working with trainees junior to you as well. The next is the feedback sandwich. Some people take negative feedback better if it's cased inside of some positive feedback. So try to think of a good thing, then give the place where there's room for improvement, and then you can follow up with another positive. This method is highly discussed, but sometimes it gets people turned off because they know that you're buttering them up with some good things only to say something negative next. Some people don't respond well to this and don't listen to this type of feedback. So it's important to think about that also. Another method is chronological feedback. This is one where you can, in a short experience, tell somebody about what they did first, what they did next, what they did next, what they did next. And you can give feedback in that way based on things in the order that they happened rather than the best or the worst in any particular order. So I'm going to need everybody to participate. I hope that some of you can put some comments into the chat. It would be much better if we were all looking at each other, but I think we have the opportunity to have a good discussion in the chat as well. So let's look at this one. In this case, we have a senior resident working with a junior resident. They're in the first week of a 4-week block, and they'll be working together for the whole month. And the senior resident believes that the junior resident is not being honest about their activities. Things like they are not reviewing their laboratories or x-rays, even though they say they have. How would you approach this situation as the senior resident? Does anyone have any ideas how you might tackle this one? In some ways, it'll be important to know the culture of the institution where you're working. But personally, I would start by speaking to the resident that is my junior, if I were the senior resident, to maybe give them some ideas of things that you've noticed. And then listen, allow them to give some feedback as well on what's been going on. I also would ask them if everything is going okay. Are they feeling overstressed? Are things okay at home? Why is it that they're not reviewing their labs and x-rays? It's also very important that the senior resident ensure their communication is not viewed as mistreatment by the junior resident. Can anyone think of any ways that we can assure that everyone finds this opportunity to give feedback is something that's productive and not something that is beating up on that resident or mistreating them in some way? I think, again, the tone that you use and the setting where you give this feedback is also very important. And so this may be something that you would step away from the clinical area, maybe sit in the lounge or have a step outside to have a conversation. Also, asking a little bit about if their personal needs are being met, if there's other things that are going on, would be really important. And then should this senior resident address this with the attending or the faculty or the consultant responsible for the service? If yes, then how, or no, then why not? Sometimes it's okay not to if you feel like you've had a conversation and it seems like the junior is aware of the need for change. And at that point, you can give it a little bit longer to see how things are progressing. If there are problems that are threatening to patient care, or if there are problems that are requiring immediate action, then it may be important to involve the consultant immediately. And that, again, could be done through a verbal conversation. If it is in writing, that may be more permanent and more distressing for the trainee. So again, you need to make sure that it's done in a way that is culturally appropriate and also that is reflective of the degree of the problem. And then should the program director be contacted? And that's something that you would discuss in our case when residents continually are not meeting the needs of the rotation, and even the consultant was not able to see improvement. So I'm going to leave these practices to you. These are in your packet with the QR code. Since no one is putting anything in the chat, I'm not sure that we need to spend a long time trying to offer people the opportunity to participate. But I want you to think about this for a minute. Think about if this was a case that you were involved in, how would you address it? A resident has an intern on their team that presented a patient to the consultant. Most of the historical elements were given, but the history was disjointed, not given in chronological order, and they left out some key surgical histories. They appropriately shared the main diagnosis of acute diverticulitis, but didn't tell the patient actually met severe sepsis criteria and actually forgot to order antibiotics initially. You would like your intern to provide a more organized presentation and give more attention and relevant details to patient care. Think about how you could approach this with your resident. What feedback behaviors could you use? If you practiced it with your neighbor, another person sitting with you watching this webinar, you could think about how the feedback you gave worked for you, and if you were able to give your trainee the information they needed. And also think about what were the changeable behaviors and examples you could give the trainee so that they could learn from this experience. What are the pitfalls and barriers to effective feedback? Here's a good list. Many times, feedback is not effective because it's not specific enough. Trainees are not offered advice on how to improve their work. Sometimes they don't respect the person who is giving them feedback, and that is important as well. They may have fear of upsetting colleagues or damaging professional relationships if giving honest feedback. Those receiving the feedback might be too defensive or resistant to receiving feedback. And then, of course, there are physical barriers. Noise, improper time, place, or space can all be problems for giving feedback. So again, think about finding that place that is outside of the hustle and bustle of the emergency department and give some privacy. Again, consider personal agendas and the confidence that you have in the feedback that you're offering. This was what I was dealing with yesterday when I was in the emergency department. The lady in the top left was exactly what I was dealing with. I was trying to debrief a very difficult resuscitation with my trainees. And at the same time, someone is calling me on the phone, another is giving me an EKG to sign, and 3 other distractions were happening at the same time. It was not a good place to give feedback. We also need to think about our facial expressions and nonverbal cues. What you don't say is sometimes just as important as what you do. We want to be sure that the volume and the tone of our feedback is appropriate for the situation, and that we're paying full attention to the situation going on, not distracted by our electronic devices, beepers, and other things. This article is also in your packet, and I would very much recommend that you take a chance to read it. These 12 points of practice for giving effective feedback in the clinical environment each have their own description in the paper. I think we've talked about many of these already. I think it's very important to base feedback on your own direct observation of the behavior of the trainee. Make sure that the feedback is timely and it happens regularly. Reinforce and correct observed behaviors. Use specific language. And make sure that the learner has the chance to process and understand the feedback that you're giving. Definitely leave with action plans. And then importantly, think about your own skills in giving feedback. Opportunities like this to develop understanding of principles of feedback and to practice giving feedback can improve your skills and promote better feedback in the whole institution. And then finally, it's important to make feedback a part of your institutional culture so that everyone is readily giving and receiving feedback. What does it mean to receive feedback well? You must listen well. Ask for further information if you need clarification. Recognize that feedback is an opportunity to learn from our mistakes. And even when we are doing very well, there's always something that can be tweaked to improve. Don't jump to conclusions or decide what your faculty member is saying about your behavior or your actions. Listen to what they have to say. Demonstrate that you're invested in improving your practice. Be positive, learn from your mistakes, show appreciation for those who are giving feedback, be motivated, and be proactive. Here we have one final opportunity to practice. And so again, I want you to think about the ways that you would respond, both as the resident and the junior. This case is in your packet. Think about this as a type of feedback as well. And does anyone see here? What kind of feedback are we giving? Is this direct, indirect, summative, or formative? The key is that this is mid-month feedback during a rotation. So this is going to be formative feedback, an opportunity for the junior resident to learn what the senior resident is assessing and to take that opportunity to make changes before the final evaluation. As you can see, the trainee and the senior resident are not on the same page. And this is going to be an important opportunity for them to come to terms and to better align for the next few weeks if good feedback is given. This trainee was very confident, expecting to be flooded with praise, and feeling like they're doing everything right. If the senior gives feedback that praises the fact that they are always prompt, that they are always reading, and that they are fun to work with, hopefully that can offset the need to change the speed at which things are happening and to give some better future work. In this case, they can also lay out the groundwork for how things might be done differently in the coming weeks, offering a plan of a way to move forward. Perhaps some tips of one or two things they want to see them try on their rotation tomorrow. So this is the take-home message. We want to be sure that everyone is in a learning environment that can foster feedback. We want to be sure that effective feedback has the potential to improve skills and change the learner's behavior. And we want to use a structured format to provide feedback. Pendleton's model is just one example. We have the feedback sandwich, we had chronological. There's several ways that we can do this. We want to assist in self-reflection and be sure that we are providing clear and constructive advice. I'd very much recommend that each of you take some time to practice using some opportunities for feedback. I gave you two cases with a senior and a junior trainee that you can practice. Take turns working on these with other people that are working with you so that you each can practice the role and give each other feedback on how you gave feedback for that matter. Also, you could practice, imagine debriefing after a procedure, like placing a central line or a thoracostomy tube, and give feedback on the steps that were given. You also can debrief with a team and give feedback to a team, perhaps after a resuscitation or a very engaging case that uses multiple people. I know that we did not get to practice as a group in this webinar format, and I do thank Dr. Hussain for putting some comments in the Q&A. I'm just seeing them now. I apologize. But I think that you all have had the opportunity to hear about some of the feedback, and I hope that you'll offer any questions that you have. Please feel free to reach out to me by email or on Twitter. But I'm also available now and would love to take any questions that you have in the Q&A or in the chat.
Yeah, that was a beautiful presentation. Thanks a lot. It's good actually. So guys, if there are any doubts, you can just drop it in the box, please. I don't think there'll be much questions, I guess. It was very clear. Let's see.
I hope you will take some of these ideas and try them with the people that you're working with.
Sure, 100%.
You
Hope
don't
that will
need to
apply this.
be, yes, you don't need to be in a position to give a grade to give good feedback to people that you're working with.
Yeah. Yeah, well, there are no much questions actually. So we'll close the session. If there are any questions, guys, you can post directly to Dr. DeVos. This mail ID, you can directly give it over there, drop it over there. Dr. Srinath, sir, he's not there, I guess. Anyways, thanks a lot for the wonderful presentation. It was good. Thank you.
Thank you very much for having me today. I hope you all have a wonderful evening. Take care.
Thank you. See you.